Nursing 474, Major Health Issues and Chronic Disease Management of Adults Across the Lifespan. The weekly learning objectives include use evidence-based practices to support care of families within the community, explain potential barriers to community health initiatives and how to resolve them, choose interventions appropriate to an identified community health problem, select technologies to inform, communicate, and enhance health knowledge, prepare an evaluation plan for the community health wellness plan. Health policy and legislation. Health policy is action taken by public and private agencies to promote health, reflects the values held by society, and greatly influences the health of citizens overall. Legislation is the laws that regulate healthcare and promote health. To be fully engaged in improving healthcare from the bedside to the community level, nurses must understand how policy and legislation, along with other system factors such as social, cultural, and economic forces, can be incorporated into planning care for clients. Ethical and legal issues and legislation for older adults. Ethical issues regarding the care and treatment of older adults arise as the population continues to age and technology advances continue to be developed. The most common of these issues involve decision-making. Elder abuse, defined by AOA's National Center on Elder Abuse, encompasses physical, emotional, and sexual abuse, as well as exploitation, neglect, and abandonment. Neglect is defined by the NCAA as the refusal or failure to fulfill any part of a person's obligations or duties to an elder, but state legal definitions may vary. Financial exploitation is the illegal or improper act or process of an individual, including a caregiver, using resources of an older adult or older individual for monetary or personal benefit. The Patient Self-Determination Act requires those providers receiving Medicare or Medicaid funds to give clients written information regarding their legal options for treatment choices if they become incapacitated. Advanced directives such as the living will or durable medical power of attorney and physician do not resuscitate orders are included. Environmental impact of an unhealthy environment adds significantly to the burden of disease for men and women. Both gender and sex are factors that make identification of the impact of environmental hazards on men and women more complex because they may respond differently to environmental factors. Health status indicators are the quantitative and qualitative measures used to describe the level of well-being or illness present in a defined population or to describe related attributes or risk factors. The CDC's major strategic planning process, the Future Initiative, developed a set of health promotion goals to track measures of mortality and morbidity by life stages characterized by 4 themes: healthy people in every stage of life, healthy people in healthy places, prepared people for emerging health threats, and healthy people in a healthy world. Improvements were noted among all life stages with the exception of adults. Chronic disease is the leading cause of preventable deaths, disability, and decreased quality of life, with the most common and costly chronic diseases being heart disease, diabetes, stroke, cancer, and arthritis. Cardiovascular disease. Greater than 1 in 3 American adults have one or more types of cardiovascular disease. It is the leading cause of death for African Americans, American Indians, Alaska Natives, Hispanics, and Caucasians in the United States for both men and women. Approximately 23 of the Healthy People 2020 objectives focus on cardiovascular disease. Hypertension, or high blood pressure, occurs in 1 in 3 in the United States adults. Because hypertension does not have symptoms, 1/3 of these people do not know they have the disease. Uncontrolled hypertension leads to heart attack, stroke, kidney damage, and a host of other complications. Strokes have decreased in the United States since the 1950s. African Americans have almost twice the risk of the first-time strokes than whites, and Mexican Americans have an increased incidence of stroke over non-Hispanic whites. Stroke is responsible for 1 in 18 deaths. Diabetes is a serious public health challenge for the United States. 1 in 12 to 13 adults reportedly has diabetes. For every 3 people who have diabetes, there is another who has undiagnosed diabetes. Cancers of all types are a serious public health concern. Malignant neoplasms are the second leading cause of death in the United States. Early screening and detection, promotion of healthy lifestyles, expanding access to services, and improving cancer treatments help to reduce the burden of cancer and disparities. STDs, HIV, and AIDS. Sexually transmitted disease pathology or damage occurring with or without symptoms refers to more than 25 infectious organisms transmitted primarily through sexual activity or contact or other means of transmission. Americans spend a great deal of time, energy, and money in the never-ending pursuit of the beautiful body. In 1998, the National Institute of Health began using the calculation of body mass index. BMI is the relationship of body weight and height to define overweight. BMI of 25 to 29 and obesity, so overweight at BMI of 25 to 29.9 and obesity a BMI of 30 or above in individuals. It is preferable to emphasize prevention, which includes screening, immunization, and healthy lifestyle in adult health care. For women, the Office of Women's Health has compiled guidelines entitled General Screenings and Immunizations for Women. Men's health concerns. It is important to realize that the health status of one gender impacts the health status of the other, the children, and ultimately the society. However, although a vital aspect of community health, men's health is often overlooked and barriers exist that prevent men from reaching their full health potential. Although health policies, campaigns, and community health organizations offer services for men, there is a bias in which women's health is emphasized. Other barriers negatively affect men's health, especially men at the lowest socioeconomic levels or those unable to work. Men often put work ahead of their own health needs. Several barriers to men reaching their full health potential have been identified, including the traditional masculine gender role learned through socialization. Men are socialized to ignore pain, be self-reliant, and be achievement-oriented. Large numbers of men do not receive the health screenings intended to prevent and identify disease and are often employed in dangerous jobs and incur more work-related injuries than women. By being aware of biases and barriers, nurses can develop strategies to help to get men involved in lifestyle changes that prevent illnesses, encouraging men to identify primary care providers and obtain physical examinations and recommended screening tests. Health disparities among special groups of adults. Health disparities present political implications and influence government actions, including the commitment of resources to address them. The United States Division of Health and Human Services National Partnership for Action describes health disparities as the persistent gaps between health statuses of minorities and non-minorities in the United States, and states that although the causes are complex, 2 major factors exist: inadequate access to care and substandard quality of care. Community-based model for care of adults. Communities are where people live, work, and socialize. Knowledge of community resources is a fundamental part of caring for an adult with special needs in any community. Such agency as the area agencies on aging and information and referral systems are examples of community-based service coordination planning. So some community care settings include senior citizen centers, which were developed in the early 1940s to provide social and recreational activities. Adult day health. Adult day health is for individuals whose mental or physical function requires them to obtain more health care and supervision, serving more as a medical model than the senior citizens centers. Home health and hospice. Home health can be provided by multidisciplinary teams with nurses providing environmental assessments, direct skilled care and treatment, and short-term guidance and instruction, working closely with family and other caregivers. Hospice represents a philosophy of caring for and supporting life to its fullest until death occurs. Assisted living covers a wide variety of choices, from single shared room to opulent independent living accommodations in a full-service life care community. Long-term care and rehab, often known as nursing homes or long-term care facilities, house only about 5% of the older population at any given time. However, 25% of those adults older than 65 will spend some time in a nursing home. Rehabilitation is a combination of physical, occupational, psychological, and speech therapy to help debilitated persons maintain or recover in their physical capabilities.